There has been a major breakthrough in the prediction of Alzheimer's disease. A new study says a spinal fluid test can accurately predict whether a patient will develop the disease. Here with more is our own Dr. Jennifer Ashton. Good morning.
Good morning, Harry.
So how does the test work? Is this a real spinal tap?
This is a spinal tap, also known as a lumbar puncture. And what that is a small needle, very fine needle that's inserted at the base of someone's spine in their back that collects some of the fluid that circulates around the brain. And what they're looking for are two proteins known as tau and amyloid, which accumulate in the brain of people with Alzheimer's disease, clog up the transmission of the signals that go between nerve cells, and then comes out in this spinal fluid. So when that's removed with this simple needle, a simple spinal tap, it can then be studied, and this test is found to be very accurate, Harry.
That's the front page of the Times that says it's basically 100% accurate.
That's right. Let's go through the numbers. So what they looked at about 300 patients, and what they found is in 90% of patients with Alzheimer's, they found these proteins. They found them in 72% of patients with mild cognitive impairment, so they're showing signs of memory loss. And then, Harry, they found them in 36% of people who were normal.
Wow. What is it? How do you interpret that data then? When you look at that data, what does that tell you?
Well, I'll tell you how the test was 100% accurate, Harry. In the patients with mild cognitive impairment, so they were just starting to become, as we say, symptomatic, all of those patients, 100% of them, went on to develop full-blown Alzheimer's disease in a period of 5 years following the test. And the key in this field, and we're hearing more and more about it, it's really exploding, is identification of patients who are at risk so that then early intervention can occur with medication possibly, so that you can stave off the development of the symptoms that make this disease so devastating.
Can we put the graphic back up again? Because that was interesting to me. This 36%, though, that had no symptoms whatsoever. What do you extrapolate from that?
Well, what they're saying now is that that might be very helpful in identifying a large population of people who are at high risk for Alzheimer's. This is not a black or white scenario. So you do sometimes see these proteins in brains of people who are not severely symptomatic. So it is not 100%, but in the group that had the mild cognitive impairment, all of those patients with these proteins did go on. So that 36% represents a population who is at risk.
Let me just ask you a hypothetical. I go in, I get the spinal tap, I get the thing. There are some of these proteins that you just outlined before. Does that mean I'll end up with Alzheimer's, or we don't really know?
We don't fully understand that yet, Harry. And a big focus in this disease in terms of prevention, diagnosis, and treatment is obviously the last category. Treating those patients, you want to get that ball in motion before someone is so impaired. And sometimes that involves planning. Sometimes, hopefully, that will involve early intervention with medication. But again, that is a huge segment of the population that we want to target, and this is very important.
In the meantime, so many of us do crosswords all the time now, do all these other kinds of things to try to keep our brains nimble.
Keep your brain active, and as we say before, what's good for the heart is good for the brain. Eat a healthy diet, exercise, know your family history, and you're going to be hearing more and more about this. Seems day to day.
So many more people are getting it. All right.
Absolutely.
Dr. Ashton, thanks.